very quickly, since this is all you have today, so you know I don't like wasting anyone's time. All right, so let's get into it. Okay, so what is immunohematology? We're focusing what? On red blood cells, antigens, and antibodies, which is your antibodies, right? What is the difference between a donor and a recipient? The donor is the blood provider, the recipient is receiving that blood product, right? Okay, so remember we talked about that Bombay phenotype, and why is Bombay looks like O blood? What is it about it that the Bombay phenotype has? Okay, did y'all hear that? The Bombay resembles O blood type because it has that absence of the A antigen, all right, and it's incompatible with that type of blood during cross-matching. All right, still being recorded, right? Okay.
Mime it. Mime it.
Okay. At what age does natural sensitization occur?
6 months.
6 months of age. Good. All right, so we know our blood types, O, A, B, and AB, and Bombay. Okay, so if I provide you with a blood type O, what type of antibodies would be on that present in the plasma serum? Anti-A, anti-B, right. And we talked about Bombay. If it's AB blood type, what kind of antigens do they have? A and B. And then what antibodies would be circulating?
None.
None. Okay. So individuals with that D antigen are what? Rh negative or positive?
Positive.
If they're lacking that D antigen, they are Rh negative. Okay. What's more popular? Positive. All right, remember I told you I'm going to provide you with this exact thing, right? I'm just going to show you an example of a forward typing, and I want you to know the reverse typing. So if I provide you with that forward typing, and I say that the patient had a 4+ anti-A and a negative anti-B, what would their reverse typing look like?
Negative.
Their
what would the
A cells would
reverse?
be what?
Their A would be
Yeah, and then their B cells would be positive, right? And you know that that person's blood type is a what? A, and if it's Rh negative, then they're what? A negative, okay? So as long as you understand this, if I provide you with a forward typing of a patient's cell with A, anti-A negative, but the anti-B is positive, and the Rh is positive, what type of blood type are they? B positive. So then their reverse typing would be what? Their A cells would be 4+, and the B cells would be negative, okay? All right, we got our major cross matching and minor cross matching, right? So your immediate spin, we use in emergency situations, right? And then your AHD cross matching, we use in non-emergency situations, and we use those for those who have known antibodies or a history of transfusions. So just please know the difference between those two in major cross matches. Okay. All right, you have your direct BAT versus your indirect. All right. Direct is in vivo, so we are testing the patient's red blood cells, as opposed to the indirect, where we are detecting antibodies in the patient's plasma or serum. Okay. Okay. So, what is an example of a major incompatibility? So that would be a recipient of antibodies are incompatible with the donor's antibodies. All right. So a type A patient that receives a B type blood, that's considered a major incompatibility. A minor incompatibility is when a donor's antibodies are incompatible with the recipient's antibodies. So an example, a type A patient receives plasma from a type B donor. I don't think I have any, but before I move on, let me make sure that I hit that correctly. day, natural sensitization, compatibility. Okay, what is autoimmune hemolytic anemia? You remember what that is?
Where the patient's antibodies attack the recipient blood.
Okay, good. What else? Okay, so autoimmune hemolytic anemia is a positive direct anti-gluten test for the IgG antibodies. The anemia is you're gonna have low hemoglobin and hematocrit. You're gonna have an elevated reticulocyte count, and there will be symptoms like jaundice, fatigue, and dark urine. Okay, so there will be a question on the test about that. All right. Yeah, I'm just gonna, you know what I'm gonna do? I'm just gonna close this and I'm just gonna read what I have here, okay? So if you have a surgical patient with a type O blood and they require 2 units of packed red blood cells, what blood type is compatible for the transfusion? You said it.
You said that they are a type O?
Yes.
Type O.
They- Yeah, so their
Type
packed
O.
RBCs would be type O, correct? Alright. And then, okay, so if you have a patient that's a type, a B type blood type, okay? They're coming into the ER, they got some training-related injuries, significant blood loss, and she requires a transfusion of packed red blood cells and fresh frozen plasma. What can she receive? What types?
B and O.
So packed red blood cells would be B, and then the FFP would be what?
B and A.
AB, FFP, correct. Good. All right, that's for 1. All right, let's move on to lecture 2. All right. A pregnant woman, if she needs a blood transfusion, what's the best type of blood product she should receive?
Or CMV negative.
CMV negative packed red blood cells, correct. All right. What is the best blood component for patients with hypofibrinogenemia? Cryoprecipitate. And why is that?
Because it just takes out the clotting factor. Like it-
Yeah, it has that clotting factors in it, right? And it's very rich in fibrinogen. Good. Right? So if you have a pregnant woman, she's O negative, she's carrying a positive baby. And she's going through a hemorrhage. What type of test should you run? Cliver Beck
something.
test or the acid elution test?
Cliver Beck test.
Also, what does she need at 28 weeks? Rhodium, good. Talked about hemorrhage, good. All right, so you do a transfusion, they're having a transfusion reaction. What's the first thing you do? Stop it, and then what's the next thing you do after that? Before you draw some labs, before you do that, you're looking for what errors? Clerical errors, okay? Stop the transfusion and look for clerical errors, okay? All right, you have a 60-year-old male. He develops fever, chills, and hemolysis short after receiving packed red blood cell transfusion. What do you think would be the most common cause of a transfusion reaction? A major mismatch, which is between what? Wrong type, between antigen and antibody interactions. You got that right. Okay, so what are some symptoms and some lab results of a delayed hemolytic reaction? Well, a lot of time a delay will occur days or weeks after the transfusion. That's one. All right. Some symptoms include fever, jaundice, hemoglobinuria, high retic count, and in the blood smear, we'll see presence of trypanocytes. So once you see that, once you see trypanocytes, you'll know that's going to be a delayed hemolytic reaction. Here, we talked about clerical errors. All right, so for a patient that has polycythemia vera, what kind of blood donation are they going to get? Therapeutic. And what is therapeutic? Exactly. It's a removal of specific blood. So how is therapeutic different from a hemopheresis?
Because you're getting put back. What they don't take, you're getting put back in.
Right. So therapeutic is removing, and hemopheresis, you're giving a portion, either that's platelets or that's plasma, whatever, and if you have a patient that's suspected IgA deficiency, what are you thinking is going on? Yeah, an anaphylactic reaction. So patients with IgA deficiency and anti-IgA antibodies are at a high risk of anaphylactic reaction due to exposure to donor IgA and its standard blood products. Okay, and the last one, I think we talked about that. Okay, so let's move on to lecture 3. All right, this is the one that Colonel Johnson had taught. All right, so a 25-year-old male is brought to the emergency room 5 hours after a possible arsenic and mercury exposure. What type of specimen should be collected for the most effective toxicology testing? Urine. Good. Which, if you had someone that had a recent exposure, what's the best specimen to collect? Gastric. Good. All right. Anytime somebody's going for a drug test for a new job, what are they looking for?
Drugs of abuse.
Yeah, so detects of any type of past drug use or exposure. All right, so you have a person that comes to the ER, you have a suspected intravenous overdose. What type of drug testing is the most appropriate in an acute setting? Blood is one, but what kind of testing? Point of care testing. Good. Point of care urine screening specifically. Okay, for this question. All right, so what is therapeutic drug monitoring? Say that again.
Monitoring of blood levels of a drug that has a low therapeutic window.
Yes. Very good. Yeah. There you go. Okay, so if you have a patient, they have a history of heart failure, they present with nausea, vomiting, confusion, visual changes, and he's currently taking digoxin, you would then do therapeutic drug monitoring. Okay. All right. You understand unpredictable dose response? All right. This reflects the unpredictability in how individuals respond to the same dose of medication. So you provide some type of medication like digoxin to one patient, they develop nausea and arrhythmias, but you give it to another, and they have no adverse effects. That's just saying that there is unpredictable dose response. What's a subtherapeutic subtherapeutic? What is that? Below the therapeutic range, and supratherapeutic. Yeah. So the difference between those two. Okay, a 28-year-old male with a history of seizures is started on phenotypic therapy. He is undergoing the therapeutic drug monitoring to ensure seizure control. When should serum phenolketonuria levels be measured to accurately correlate with therapeutic effect? After the steady state concentration is reached. Okay, we talked about gastric contents. Got that. Okay, what's the detection window for marijuana in urine?
20 to 30 days.
Yeah, 3 to 4 weeks. Okay, that's the test answer. That's probably something else for the test tomorrow. Okay, for Wednesday. Okay. We know about CSF, so how many tubes do you collect for CSF? How many drops? 10
drops.
10 drops. Okay.
That's next time.
All right, what is the, what meningitis has the highest mortality rate?
No, parasitic.
Parasitic meningitis has the highest mortality rate. Right. Punctures. Okay, congestive heart failure. What would that pleural fluid analysis look like? Transidae, So low cell count, low protein. And what's the opposite? Exudate, which would have high protein, high cell count. Okay. Septic arthritis, what does that look like? Laboratory wise. White blood cells would be high, right? Yep. Gram staining, what will we see? What kind of bacteria? Gram positive bacteria, is possible. A lot of neutrophils. Okay. Yeah. Pericarditis is what? Yeah, fluid around the heart. And we know the difference between the crystals with gout and pseudo-gout. So gout has what crystals? MSQ, and pseudo-gout has CPPD. When would we run an alpha fetoprotein test? Okay, so it's seen in pregnant women, and we're looking for neural tube defects, okay? Fetal neural tube defects for the AFP. Okay. Lecture 5. Okay, positive predictive value. Okay, a patient is tested for a specific infectious disease using a diagnostic test with a positive predictive value of 95%. What does this PPV indicate? So if positive, 95%, there's a 95% chance that the patient actually has the disease. All right, so let's get into tubes. So your EDTA tube, it's just what color is that? And what kind of testing can we run on that? CBC, hematocrit, yeah, hemoglobin. Okay, you have your blue top tubes, your royal blue. What is that used for?
Specific metals.
Yeah, so heavy metals, right? So lead, arsenic, things like that. Okay. Your green top tubes, specifically what kind of tests? Cardiac markers. What else? Renal. What else? Okay, renal. Yep. Yep. So all your chemistry testing. Okay. All right. So then we have that tiger top tube that has that gel in it. What is so significant about that gel? That gel separator. So that gel, one, it separates that whole blood from that serum. That's one, and that gel has what's called clot activation. So it'll increase the amount of clotting time for the red blood cells for it to fall on the bottom. That's all it is. Okay. So it's called an SST. So serum separator tube speeds up processing via clot activation. You know what purple top is. We know what royal blue is. Yep. And I think I asked that already. So the most, for toxicology testing, what is the most commonly used? The sample? So here it says urine sample. Okay? So urine is commonly used specimen for toxicology testing. So okay, that's why I changed this question. So what I put in this question was, you have someone that comes in, you're deployed, you have somebody that comes in, they're vomiting, they got abdominal pain, they got diarrhea, and you're limited with tubes. What is your next best specimen? It would be urine. Okay, that's what you're at. But yes, you would draw blood first. All right. So you have a 32-year-old female undergoes routine screening for a communicable disease common in the general populations. The test used has high specificity. The patient receives a positive result. Based on the principle of specificity, spin in, what is the likelihood of the patient having the disease? Highly likely, right? So specificity refers to the test's ability to correctly identify those without the disease. And then what's the other one? Spin out, and that's telling you what? The likelihood that they don't have the disease. If it says it's negative, that means that they don't have it. ask y'all that. Okay, I think I hit, pretty sure I hit like on both of it. Yeah. Got any questions for me? Okay, so that was about 20 minutes. That was a little longer than last time I was here, right? So I was trying not to waste your time. I know you had to get up early and get through traffic. Just trying to make it worth your while, but yeah, that's pretty much the story of it. And I know a lot of this you all have already gotten before, so y'all gonna rock it. Okay, that's all I have. Unless you have, yes, sir.
And the, so that forward typing, reverse typing,
Mhm.
is that the same as DAT and IAT?
Yes,
Okay.
yes, exactly.
That's where I'm at on that.
Yeah, I'm trying to cut a lot of it out because we can, like, I could talk to you about this and y'all would just glaze over. So I'm just, yeah. Like I said, we spent 6 weeks on this in lab, so yeah. But yes, you got it. Okay. Any other questions?
Ma'am,
Yes.
will you like go over again on that forward typing and reverse typing?
Sure.
I get a little confused.
Okay. All right, so forward typing. So forward typing, we're pretty much taking our patient cells and then we're mixing it with some commercial antibodies. That's what we're doing with forward typing. Okay? So, so if you have a patient who is negative and you mix that commercial anti-A in there and it's negative, and you mix the anti-B and it's negative, what blood type are you getting? Just right off the bat. If you mix the patient cell with the commercial antibody A, right, and it's negative, the patient cells with the commercial antibody B and it's negative, what is that telling you? That they're an O, right? And if their RH typing is positive, that means what? They're RH positive, okay? So then we're gonna do the reverse. So then the reverse, we're gonna take their actual serum and then we're gonna mix them with cells. So if the serum and the cells are put together and it's a 4+, and we take the B cells and it's a 4+, that's confirming that O type blood. Okay? Okay. So if you do, let's go to the next one. So you have a patient, the answer for the forward typing, the patient cells, the anti-A is positive, but then the anti-B is negative. What's that telling you the blood type? You know? It's gonna be A. Okay? If a B in forward typing, that means that the anti-B would be positive in the forward typing. Okay? Like I said, I just told y'all straight up which one I'm gonna tell you, right? I already told you if the one I'm gonna tell you is if the patient cells plus the commercial anti-A is 4+, the patient cells plus the commercial anti-B is negative, that tells you what? That they're A. If the RH is negative, that tells you they're negative, okay? So that means the reverse typing should be what? So reverse typing, the A1 cell should be negative and the B cell should be positive. Okay? That's really the question actually. Okay, so no vote. Now if they want to ask you in junior and senior, that's fine, but Major Brown's class, no. It's that, okay? Any other questions? Good? Okay, y'all. I will see y'all Wednesday morning. You gotta rock it like y'all always